What if we could unlock a child's bright future, send her to school, give her the tools to strengthen her community? We can, if she isn't hungry. We can, if she doesn't spend hours a day fetching water that isn't even clean. We can, if we champion integrated solutions to some of the world's most complex problems. At Action Against Hunger, we know that healthy bodies fuel bright futures. That's why we're committed to ensuring access to good nutrition. We treated 5 million people for malnutrition and illness last year and served more than 13 million people in total. But the need is tremendous. A child dies from hunger every 30 seconds. That's over 1 million children dying each year, all because they lack access to basic treatment. For over 35 years, we've stood on the front line of the fight against hunger. From responding swiftly in emergencies to providing long-term food security solutions. We've discovered innovative approaches that affect lasting change. We're on the front line in West Pokot, Kenya, where our nutrition, water, and food security programs work in harmony. The power of our programming is in our people. People like Jedediah, a nutrition officer. Jedediah and her colleagues support 20 outreach sites, treating 70,000 people, including moms like Pauline. Like many Kenyan mothers who are breadwinners, Pauline's daily life is focused on providing for her children and taking care of daily chores to ensure their survival. Living in a rural community with little or no access to basic human needs, Pauline didn't have the time or support she needed to breastfeed her first child. But when her second baby was born, Pauline joined one of our mother-to-mother support groups in an outreach site close to her home, where she learned about the importance of breastfeeding. She's been taking her children there for checkups and vaccinations, and has been able to exclusively breastfeed her second child, ensuring a healthy start for the newest member of her family. Some solutions are simple, but have a huge impact. Solutions like measuring a child's mid-upper arm circumference to screen for malnutrition, or using purifying sachets to make safe drinking water. Our front line is also in Nepal, which is dealing with the aftermath of 2 devastating earthquakes. Our experts were already working there for nearly a decade, and we quickly scaled up to full emergency response, focusing not only on water and hygiene, but also on providing professional counseling to help Nepalese families cope with their grief and get back on their feet. And our front line is in the war-torn Democratic Republic of Congo, the world's deadliest conflict since World War II, where we build capacity for communities to empower themselves. We build the infrastructure together, training workers who can maintain water points and forming water committees made up of local residents to manage those points. These people, these stories, imagine them weaving a web of passionate action by more than 6,500 humanitarians in nearly 50 countries around the world. Together, they create a constellation of ideas, innovations, and solutions to inspire our planet and all its people to be healthier, stronger, and more resilient. Because every child deserves a healthy body and a bright future. What if we could create a world free from hunger in our lifetime? We can. We must. Join us.
Santeni.